it's me again, Alona, your lactation consultant. So today, it's going to be a different day that I want to talk about your milk, our breast milk, our colostrum, our mature milk. What's the difference between your colostrum and the mature milk? And when can you tell that you have the mature milk? So today, it's going to be information for everyone, all mothers in the whole world. We have to talk about it because our milk is considered as the superfood, the golden milk, and especially nowadays that there's too much shortage now of formula all over the world. It's time to learn more about breastfeeding. So for some of you who are doing your mixed feeding or you're doing your formula feeding, you're more welcome to watch these videos so that you'll be able to understand. You never know, you get pregnant again and you'll have baby again. So this is it. This is one of the most important information that I always teach mothers during a hospital stay or after they discharge, so that you get some ideas on what's really in my milk. Why this milk is so precious? Why this milk is called golden milk? Why this milk is called superfood? So today it's gonna be colostrum and mature milk day. So when do we get that colostrum? When do you think we have that milk? So normally when you're pregnant, around maybe during the first trimester, normally some women would get the leaking of their milk. Okay, I've been there. One morning I woke up and I said, what is this? I was totally soaked one morning when I was pregnant and I didn't know what was it. So that's the first time that you see, oh, I got the milk. However, okay, if you are pregnant right now or you're planning to get pregnant and then during the first trimester you feel like you've been leaking of your milk, the so-called colostrum, pre-colostrum, that's not an indication that after you give birth that you're gonna have tons of milk. No. Based on research, there's some women who've been leaking milk during pregnancy, but they all still struggle to produce milk after they gave birth. So it's not an indication that, oh, I've been leaking now, I'm pregnant, probably after I give birth I got tons of milk. No. So every woman is different, every breast is different. So after you give birth, normally during the first 6 days, based on research, during the first 6 days, that's like the colostral phase of your milk, the colostrum phase, okay? During the 4th day of your milk, sometimes that's the start of that transition into the mature milk, okay? So some women may have delayed coming in of mature milk. Some women may have early coming in of mature milk, maybe after 4 days or maybe after 6 days. But normally, during the first few days, 3 to 5 days after you give birth, that's the time that you'll feel like, you're starting to get engorged, you're starting to get full, and what you have is a colostrum. Now, many during my workshops, when I do breastfeeding workshops, moms would ask, what's in our colostrum? Because there are so many moms, based on my experience at the hospital, after they gave birth, when they look at their colostrum and they put it in a little med cup, or when they squeeze their breast, they only have a few drops, they get so worried that it's not enough for their baby. They get so worried. They're already thinking about, oh, where's the bottle? Where's the formula? Because again, most of these moms do not really have clear understanding of what's really in that colostrum. So let me just give you the most important components of that colostrum, why we really want babies to get it. Even though you have plans of mixed feeding or you have plans of giving formula, let me tell you what's really in that colostrum. So the number one thing that we need to really learn about why colostrum is called the golden milk, because it's very high, very high in protein during the first 4-6 days, very high in sodium, high in chloride, very high in vitamins, minerals, fatty acids, very high, okay, very, very high, up to 9 times very high of antimicrobial, antibacterial, anti-allergen. So could you imagine if we have 9 times protection from those little drops of colostrum after we give birth? Could you imagine on how much we protect that baby's health if we give that colostrum right away before you even give that bottle? And here's the thing, that colostrum that we gave to the baby based on research would really protect the baby's immune system. Remember, 9 times? Even after as the baby gets older, but mostly during the 6 months of baby's life. And based on research nowadays, all over the world, there are newborn babies died because of infection. And most of these babies are not exclusively breastfeeding. Babies that are less than 6 months or more than 6 months. But most of this death from baby are caused by infection, okay? Neck infection. Now, how can we prevent that? By giving this 9 times anti-infectant colostrum. So, based on my experience, when I was helping moms after birth at the hospital, there are moms that when I'm help them express the colostrum, they can only get few drops, maybe 10 drops, or maybe even 5 drops, and they're kind of disappointed when they see it, because they were imagining when they were leaking during pregnancy that maybe the same thing after they gave birth. It's not. It won't be like that for some moms. It won't be like that. Why? Because there are so many factors that causing why the milk did not come in so early yet. Because again, what if you've been having long labor, maybe 18 hours, 15 hours labor? Your body is just so tired. Or you just have a C-section, you're in pain, you're so tired, you're still kind of drowsy, the side effect of the medication. So these are the things that can really affect on how you produce milk. And it may take days. Some moms probably 2 days, 3 days, they still don't feel like doing goals. They still don't feel like that the milk came in. Because again, sometimes because of your medical condition, if you have history of diabetes, if you have history of hypertension, or any other medical condition that can really compromise on how you produce that colostrum and that mature milk. So for some of you who are pregnant right now or plan to get pregnant, or for some of you who just gave birth and you're still wondering, when is this big flow or tons of milk that I'm longing for? It may take a while. It may take a while, depends on how your body is responding to after you give birth. Depends on how comfortable you are. Depends on if you're stressed, if you're having difficulty coping after birth, you have no help at home. So all these things can really affect your milk. So it's not magic that, oh, I just give birth, I'm gonna have tons of colostrum, I'm gonna have mature milk in 4 or 5 days according to Nurse Alona. No. So this information I gave you are general information. It may not apply to you. It may not work for you. It may work for other women. So it's just that I'm giving you some information that will help you understand, so that though you don't get frustrated, you don't get stressed, knowing that you don't have the letdown that I just mentioned, that if you're healthy, if you're comfortable, if you have tons of milks, you may have 14 to 17 times letdown based on research, okay? Some moms may just only get 2 letdowns every breastfeeding. So that means when you only have 2 letdowns, that means the baby don't really get so much fuller after breastfeeding. So how you can increase that? Massaging your breast. If you feel like 5 days, 6 days, your milk is still very low, keep massaging your breast. If you have a breast pump, pump your breast. Even if you only see few drops of colostrum, few drops of mature milk, keep doing it every 2 to 3 hours, maybe pump for 10 minutes, depends on how comfortable you are. The more you do it, the more you stimulate it, the more you don't ignore this, the earliest your milk will come in. So don't lose don't lose hope, because I've seen so many moms in my clinic that even 2 weeks after they still don't feel full. They still don't feel engorged, because again, it depends on how your body is adapting to the new changes of the hormone withdrawal and everything. So I hope you learn really good information from this video about taking care of your babies, the latching, expressing your milk, massaging your breast, making time for yourself to rest. Okay, self-care is very important after you give birth, because if you just keep thinking on the milk, the baby, how about yourself? You need to take care of yourself, because if you are physically and mentally tired, you may not get the letdown. You may not get the amount of milk that you really wanted to. So it's best to just play by ear and see, okay, I don't have so much drop of milk right now, but I'm gonna continue massaging as what Nurse Alona is doing, advising me. Massage it. Watch my video on how you massage your breast, because that's very effective massage that I have in that video. Make sure you monitor on how you latch your baby. Watch that latching technique that I created, because no matter how slow your milk supply right now, there is a possibility that you can improve it with proper latching, deep latching, breast massaging, or continuous milk pumping, and eating healthy, sleeping good. If the baby's sleeping, have a nap. Okay, again, watch that video on how you can do the routine feeding pattern. If you have a crying baby, how to manage it. Watch those videos, because those videos can really help you on how to manage breastfeeding and how to manage formula feeding, because again, or bottle feeding, because again, I've been saying this when I'm doing workshop, breastfeeding is not easy. It's not easy for moms who are just a beginner, who just trying to establish their milk and who just trying to teach the baby how to latch. It's not easy, but later on, breastfeeding gets easier when you know that you are doing something and you're improving your latch, you're improving your milk supply, so it gets easier. So thanks for watching. This is another topic that is very important for many women out there. So please share this video. Do like this video and continue to subscribe, because there will be more videos every 2 to 3 days that I can share with you and be able to help you in your journey raising your baby, either you're formula feeding, bottle feeding, or you're doing breastfeeding, or both. Thanks for watching. See you next time.